In one of my previous video, I shared my biggest regret about moving into a nursing home. But the real shock, a nurse commented saying, "Avoid nursing homes at all costs." Think about that. Someone who works inside these facilities is warning us to stay away. If even they don't trust the system, what does that tell you? Today, we're exposing 3 shocking reasons why seniors should avoid nursing homes, backed by real stories, expert insights, and the hidden truths no one talks about. If you care about aging with dignity, freedom, and real quality of life, hit subscribe. We bring you real, proven advice to help you stay independent and thriving for years to come. Now back to the story. I've heard from countless seniors who regret moving into nursing homes. They thought they'd be safe, well cared for, and surrounded by people who truly looked after them. But reality often hits hard. And when a nurse commented on my last video, warning people to avoid nursing homes at all costs, I knew we had to keep this conversation going. Why would a nurse, someone who works inside these facilities, say that? Because they see the truth firsthand. They see exhausted staff stretched too thin to provide real care. They see rushed meals, unanswered call buttons, and seniors sitting alone for hours. They see people losing their independence, their routines, and worst of all, their will to live. If the very people working there are sounding the alarm, shouldn't we listen? Today, we're exposing 3 shocking reasons why seniors should avoid nursing homes, backed by real stories, expert insights, and the hidden truths no one talks about. And that brings us to reason number 1. 1. The hidden health risks. Most people assume that nursing homes provide top-tier medical care. Families trust that their loved ones will be safe, monitored, and given the attention they deserve. But here's what they don't tell you. Many facilities use powerful sedatives, not for medical necessity, but to keep residents manageable. Instead of treating underlying health issues, they use medications that dull emotions, energy, and even personality. One former nurse admitted, "I saw residents turned into zombies, not because they needed the meds, but because it made them easier to handle." Imagine that, being drugged into silence just because staff is too overwhelmed to provide real care. A shocking study found that up to 80% of nursing home residents contract infections like pneumonia, urinary tract infections, or antibiotic-resistant bacteria. Why? Because many facilities are dangerously understaffed. Basic hygiene gets neglected, and minor illnesses are often ignored until they become life-threatening. One resident's daughter shared, "My dad's cough was brushed off as just allergies. By the time they checked, it was pneumonia." Seniors thrive on mental stimulation, social engagement, and purpose. But in many nursing homes, daily life is rigid and repetitive. Wake up, eat, sit, sleep, repeat. Research shows that this lack of engagement can speed up dementia, depression, and cognitive decline. A heartbreaking truth. Many seniors lose their will to live simply because there's nothing to look forward to. One woman shared, "My mum was sharp before she moved in. Within months, she barely recognized me." One former caregiver revealed, "There were days when we had one nurse for 30 patients. There's no way you can give proper care in that situation. It's not about the residents, it's about the numbers." The result? Missed medications, untreated wounds, and suffering that goes unnoticed. If even the people working inside these facilities are warning us, we have to pay attention. And that brings us to reason number 2, to the emotional toll of isolation. Another lie we've been told, that nursing homes prevent loneliness. Families are reassured that their loved ones will be surrounded by people, socializing and making new friends. But in reality, many seniors feel more alone than ever once they move in. Imagine spending decades making your own decisions, when to wake up, what to eat, how to spend your day, only to have all of that taken away overnight. Many nursing homes operate on strict schedules, where meals, activities, and even bedtime are dictated. One resident shared, "It feels like I'm in a cage. I can't even have a snack when I want, let alone go outside without permission." Most people assume they'll see their loved ones just as often after moving into a facility, but the harsh truth, many seniors actually see their families less. Life gets busy, and visits become shorter and less frequent. Some residents go weeks or even months without seeing their children or grandchildren. One woman confided, "They promised they'd visit all the time. Now I mostly just see them on holidays." Studies show that nursing home residents experience higher rates of depression than seniors living at home with support. Why? Because they often feel abandoned, unheard, and stripped of purpose. Activities might be offered, but they're not always meaningful. One man explained, "I don't want to play bingo. I want to work in my garden, take a walk when I feel like it, just live my life." Moving into a nursing home isn't just about changing locations, it's about losing the life you built. Your home, your neighborhood, your daily routine, all replaced with a shared space that doesn't feel like yours. One woman I spoke to put it simply, "I lost my home, my friends, my routine. It feels like I lost myself too." Loneliness doesn't come from being alone. It comes from losing control over your own life. And that brings us to reason number 3. 3, the financial nightmare. If you think nursing homes are affordable, think again. The average cost, over $90,000 per year, and that's just for a semi-private room. A private room, over $100,000 annually. That means a lifetime of savings can be wiped out in just a few short years, leaving many seniors with nothing. Most people assume their retirement funds will last, but they don't account for the staggering cost of long-term care. Many seniors enter nursing homes believing they can afford it, only to find themselves bankrupt. And when the money runs out, they're forced onto Medicaid, which often means lower quality facilities, fewer staff, and even fewer choices. One family shared, "My dad was in a great place at first, but once his savings were gone, he was transferred to a Medicaid facility where he barely got any attention." Think that $90,000 a year covers everything? Not even close. Many nursing homes charge extra for premium services, things that should already be included in basic care. Need help with dressing or hygiene? Extra charge. Want more than the standard bland meals? Extra charge. Physical therapy? That's more money. One woman was billed hundreds of dollars for miscellaneous fees, including $50, just for cutting her father's nails. Once a senior moves into a nursing home, getting out is harder than people think. Many facilities require long-term contracts, making it difficult and expensive to leave. Others hike up costs every year, forcing families to scramble for more money. One man said, "We thought we had it covered, but the price kept going up. By year 3, my mom's account was empty, and we didn't know what to do." The nursing home industry wants you to believe there's no alternative, but that's simply not true. Aging at home with the right support can be more affordable and often leads to better health outcomes. In-home caregivers, family involvement, and community programs can provide the help. seniors need without draining their finances or taking away their independence. That's why so many seniors regret moving into nursing homes. But what's the alternative? Let's talk about a better way. The better solution: aging at home. The good news? You don't have to choose between a nursing home and struggling alone. More seniors than ever are choosing to age in place, staying in their own homes with the right support. And here's the truth many people don't realize. With the right setup, aging at home can be safer, healthier, and far more affordable than a nursing home. Many families assume full-time nursing homes are the only option when a senior needs help, but that's not true. In-home caregivers can provide everything from meal preparation and medication, reminders to mobility, assistance and companionship. The best part, it's completely customizable. Some people only need a few hours of help each week, while others may need daily care. Even full-time home care is often more affordable than a nursing home, without the isolation, loss of independence, or institutional feel. One woman shared, "Mom has a caregiver a few times a week, and she's happier than she's been in years. She gets help but still has her freedom. Years ago, aging at home came with risks. But today, technology makes it safer than ever. Medical alert systems allow seniors to call for help with the press of a button. Smart home devices can remind them to take medication, turn off the stove, and even detect falls. Telehealth services allow seniors to see a doctor without leaving home, reducing the need for unnecessary hospital visits. One caregiver said, "With today's technology, many seniors are safer in their own homes than they would be in a nursing home." Many people fear aging at home means being alone, but there are more resources than ever to stay connected and supported. Programs like Meals on Wheels provide nutritious food for those who can't cook. Senior centers offer social events, fitness classes, and group activities. Local volunteer groups help with transportation, home repairs, and daily tasks. Aging in place doesn't mean doing it alone. It means getting the right help while keeping your independence. And here's the most telling part. One nurse told me, if seniors had the right help at home, most would never need a nursing home at all. That says everything. So if you or someone you love is thinking about the future, now is the time to explore the better way. So, now you know the truth. Nursing homes aren't the safe option we've been led to believe. They come with risks, physical, emotional, and financial. But here's the thing. You have a choice. Will you let others decide your future, or will you take control of your own aging journey? If you or a loved one have experience with nursing homes, good or bad, share your story in the comments. Your insight could help someone struggling with this exact decision right now. Join a community that challenges outdated beliefs. If this video opened your eyes, hit subscribe and turn on notifications. Here, we uncover the real truths about aging and explore better ways to stay independent, fulfilled, and thriving. Aging should never mean losing control. It's time to rethink what's possible together.